graduates pretty much can leave and go anywhere and do anything they want. And that's reflected in where they go. So they take academic positions. We've had folks take leadership positions in clinical settings. Some have gone on to fellowships. One actually recent graduate became a fellowship program director, which was satisfying for me. So that's kind of where our emphasis is. I'm Julie Sadhu in the Pritzker Department of Psychiatry and Behavioral Health. So I'm the program director for the Child and Adolescent Psychiatry Fellowship Program. I oversee the program administration. I take a look at all of their training experiences, and then I also provide supervision. And when I meet with them once a month, we talk about systems issues, questions that they have, and I have an open door policy. So my office is very close to their offices, and so they're able to walk in anytime, ask me questions, or email. Lurie Children's is one of the top pediatric hospitals in the country, and it's the top hospital actually in the state of Illinois in terms of pediatric hospitals. So I think that, you can't state that enough, that it makes for a really rich learning environment. We have faculty that have trained at institutions all over the country, and they come in with a wealth of experience, different viewpoints on how to treat patients. We also have a number of subspecialty clinics that I think are really unique. So we have a mood and anxiety program. We have the Center for Childhood Resilience, which is a really incredible organization. So they work with community partners, the Illinois Childhood Trauma Coalition, the Chicago Public Schools, to advocate for patients, to educate and train, and to serve underserved populations. We also have a forensic rotation where fellows get a chance to see the courts, to work with the lawyers, and to see a juvenile detention center, the trauma treatment team, the developmental and behavioral peds where they get to see autism. So there's a whole wealth of opportunities within the fellowship program. Our patient population is diverse, whether it be racially, ethnically, culturally, linguistically, religiously, socioeconomically, and even our payer mix. We see a large Medicaid population, but we also see private insurance patients. And we see patients from the city of Chicago, but we also see patients from the suburbs and even outlying states. So fellows really get to see a whole variety of patients and get really comfortable working with different populations. I think my primary emphasis is to produce the next generation of leaders in child and adolescent psychiatry. But we also uphold the principles that the hospital upholds, which are outstanding patient care, education, research, advocacy, and of course, diversity, equity, and inclusion. And so those are reflected in the patient care we provide, in the training we provide, in the kinds of fellows we like to attract, and in our faculty. One of the nice things is we have this big medical campus, and we have a number of hospitals that are part of the Northwestern Medical Campus. So the medical school is within walking distance. We have grand rounds that are shared with the Department of Psychiatry. So that's actually held at Prentice Women's Hospital. We have our adult colleagues over in a variety of buildings. So we get to interface with our other colleagues throughout the medical center. I think Chicago is really unique. We combine the big city feel with Midwestern appeal. And so I think the Midwest is always known for people that are really warm, friendly, down to earth. But then you've got an urban center, and so it's a cultural hub. You have fine dining, you have museums, sports teams, the lake. We have Michigan Avenue. So there are a whole bunch of things that people can do. And where we are located in Streeterville is really perfect.